everyone, welcome to the hot seat. Today I have the biggest and the greatest pleasure to have one of my closest friends here in the podcast. So, Antoine, I call you Peach actually, so let's call you Peach.
Sure.
Thank you so much for joining me and thank you for accepting the offer to be on the hot seat.
Thank you for having me.
I'll promise you I'm not gonna be that tough on you, so it's gonna be
Please do. I mean, that will be fun.
There is a lot of things that I want to discuss today.
Okay.
But the main and the biggest thing that I want to highlight is that I find fascinating how you were able to get something that is still nowadays a taboo when it comes up to topic like men's health, intimacy, and so many other topic like hair loss and so, and made it like your business. Is there anything that made you get that shift, or is there anything that brought you there? Was there any problem that you were trying to fix?
No, not really. I think it's just an observation. I think we're getting older. All the men are noticing that they are losing their hair, that they are seeing some sign of aging, but they don't really know where to start to tackle these kind of issues, right? So after basically just collecting this information with some of my partners, we decided, hey, it's time to take action. Most of the men that are losing their hair, they don't talk about it, or then they are looking for a quick fix, mostly in different countries with a hair transplant. But there is no prevention. You don't know where to start. Even worse, when it's about intimate health, you will be feeling judged, or it always feel taboo when talking about it to your best friend, your partner, your doctor. So that's what we wanted to change, because we wanted to take action, but we didn't even know where to start.
Yeah, why do you think that all of these topics are still taboo in the region and people try to avoid it?
First of all, I think there is a huge evolution, especially in the Middle East market. You can see that guys go to the barbershop twice a week sometimes to take care of their beard. So it's not about not taking care of yourself. I think guys are taking very good care of themselves in the region, even more than, let's say, in the Western countries. But then it's more about the knowledge that you know about hair loss. What do guys know about hair loss? Not much. You don't know the science behind it. You don't know the solution about it. You know the quick fixes. You know hair transplant because it has been advertised and there is a lot going online. But then you don't know all the other alternatives that there are behind it.
So that's why you offer consultancy. So you offer end-to-end solution.
So we decided basically to create a platform that will be a safe place for guys to tackle their health concern, from hair loss, intimate health, skin care, beard care. And at the beginning, we were thinking about doing a men grooming marketplace. But then we saw that most of the people that have tried this have failed, because then the focus will be exactly the same, selling products online, but without really
a marketplace, yeah.
Exactly, and
without value.
Exactly, without value and without basically the ongoing care that these challenges necessitate, you know. So that's why we decided basically to create this platform where you will have access to the most effective medications in the market, because they are personalized just for you, okay, for hair loss, for intimate health, and for beard care, and as well from consultancy to the treatment delivery, which doesn't exist today. If you want this kind of treatment, you need to go to your family doctor, then you need to go to the specialist, get a prescription from him, go to the pharmacy, and then you will be able to have it. On our situation, you do everything from your phone in a few clicks, and it will be delivered in 48 hours.
And what I've realized is actually that it's so hard, even for my husband, to go to the doctor for anything. I don't know why you guys have this issue with doctors, but it could be anything. Even just if you have a rash, you know, like I would just straight run to the doctor, right? Usually for guys, it's not like that. I don't know why.
Yeah. So first of all, I think it's different for everyone, but it's more the traditional healthcare system that looks broken to us.
Okay.
It's very time consuming. You need to book the appointment, you need to go, and most of the time you think, hey, come on, rash or even a small, virus or something, you say a few days and I will be back and I will recover, right? I don't need this medication. I don't need to go and see a doctor. So you don't take the time. And as well, you know, it's not that you can't find the information by yourself online. So you always think, okay, if it gets worse, then I will take action. But on the first place, you don't. And for your hair, it's a bit the same, isn't it? You look at yourself in the mirror, you're like, I'm losing more, but you really don't take action. until maybe your partner says so, and or
Yes.
it's getting critical, and then it's already too late.
So tell me about Aneeq.
Sure.
We didn't do an intro. So you're not just
Exactly.
building a health tech company. You're building much more, something that goes above and beyond. You're educating people, you're creating a community. So first of all, how did you get to this idea? What was the moment that you realized you wanted to jump on this? And second, what it is for everyone that is listening.
Definitely. So with my, let's say, startup background, I've been very interested in taking over some new project like this. And I've been in Dubai for now 8 years. And, I was more corporate when I started my work life in Dubai. So I decided, hey, I'm missing a challenge. And that's when basically I started to speak with different investors, co-founders and stuff like this. And the let's say ecosystem is very important on the startup environment, and that's where you can challenge your ideas, ping pong your challenges, and you're going to learn a lot. And by doing so, I met with my co-founders today, and we decided to go on this journey because we saw that basically these kind of services were available elsewhere but not in the region. And that's when we decided, okay, this is a success in the US, in Europe, we need to make it happen here. So that was the idea at the beginning. As I mentioned, we're not thinking of becoming, let's say, a big health tech. We're thinking of just developing a men grooming marketplace. Then we pivoted to the health tech platform. And today, I mean, it's been more than 2 years, year and a half, I'm working on this project. And I truly think that this is the future of health tech and of healthcare in general. Why? Because today we're only talking about the taboo topics, but tomorrow we're expanding to all the different healthcare topics. You shouldn't basically take dozens of meetings with different specialists in order to access the effective medications or the effective programs. It should be as easy as anything else is in the UAE, just a few clicks and a few hours before delivery.
And when it comes to that, you are actually operating in a highly regulated system.
Yeah.
How do you balance the innovation when it comes to staying compliant? And so you have a lot of ISO, DHA, a lot of regulation that you need to comply to.
Exactly. So that was the toughest at the beginning, to be honest. When I mentioned that I've been working on this for 2 years and a half, the first year, more than a year, I think it has been 14 months, we worked on the regulation.
Okay.
Why? Because what was existing before is the normal telehealth that you know, basically existing health facility, a clinic or an hospital that will have a telehealth license, so that will make some teleconsultation online. Okay, this is the regular thing, that we see in each and every different countries. So this kind of framework was available in the UAE. What we wanted to do is to break this kind of barrier which is existing between the patient and the doctor. We mentioned the taboo or the patient not being comfortable sharing symptoms about intimate health, about hair loss or anything else. If you still have to share the symptoms through a teleconsultation, that won't work. It won't break this barrier. So what we wanted to do is basically create an online assessment, which are exactly the same question that a doctor will ask you face-to-face, but at least it's just a bunch of questions that you're answering to for personal information, medical history, etc. And at least you don't have this. But then the regulators, DHA, MOH in the UAE, didn't have like this kind of process for telehealth. So it has been at the beginning 6 months where we designed the framework with them. So it was like back and forth meeting with the regulators for them to understand what we wanted to build, that it was existing abroad and it was a big success. So then they are listening, and then it's like, how are you going to make it happen? When we agreed on the framework, that's when we had the, let's say, green light to say, hey, you can develop it. And then we started developing it, which took us, I think, 8 months in order to have the final license. And then we started in October 2024.
Wow.
So regulation, it's a big one. You are asking about the balance between innovation and regulation. I believe you need to go step by step. Of course, for us, it was a milestone to get this license and this
in place,
exactly at the beginning, but it doesn't mean that we don't need to keep changing and keep challenging what is existing. So we keep a very good relationship with these regulators in order that as healthcare is evolving, to make sure that we are still up to date with all the regulations.
There is something that I've noticed in each of the industry nowadays is like user-centric approach. Everyone talks about it. We do digital transformation, as you know, and most of the time what we do is like redefine the customer journey and improve the customer experience and so and so. What does it mean in healthcare and what does it mean specifically for you?
So in healthcare, I won't be able to answer, to be very honest. For us, I think it's one of our biggest USP and differentiation point, because all our treatments, and that's what makes it very different, are personalized. It means today when you go to the doctor, he will prescribe to you a medication that you will pick up from the pharmacy. Most of the time, these medications, there are 1 or 2 dosages available, depending if you're a child or if you're an adult, right? This has been creating since, let's say, the 20th centuries with, let's say, this big pharmaceutical company that are starting to skyrocket and to cover the full market, right? We all know them. But initially, pharmacy, this is not how it works. The medication was made for you. And basically, that's what we are coming back to, that we personalized and compound each and every medications for you. Because your body, for example, is different than mine, is different than anybody else, and you won't need exactly the same thing. So that's how we make it very customized to each of our user, and that's why the customer is in the center and in the middle of our model.
Of your model, yeah.
Does it make sense? I mean,
100%, yeah. And I think this is a super important point to highlight, because as you said, there are a lot of things that we keep doing that were established maybe 100 years ago and the people keep following, but it shouldn't be like that. I mean, same thing, quick example, when people say about, I don't know, electrolytes, like everyone is nowadays taking electrolyte, that's pretty dumb, because like every person is different and you might be even ending up taking more electrolyte than you think, and like same thing with medicine or supplements and so on and so and so. So I think the consultancy part that you do and like the way how you regulate or the way you tailor all the prescription or all the advices based on each of the customer is the most mature way to do it.
Yeah, but further than, let's say, health tech and healthcare in general, I think longevity today is very key for our generation. Yeah. You were talking about electrolyte. There is as well all the tools that we have been using to track and control our health, or even, all these supplements. I mean, right now, health is really at the center of what truly matters to us. Look at the amount of sports that we're doing. And I mean, I think like this generation is really focused into this longevity. And that's why for me, it shouldn't be, try this works for everyone. Yes. No, everyone has his own path. Everyone has his own metabolism. The X number of hours of sport a week won't work for you, will work for me. The nutrition, I mean, everything, you need to make your own research. You need to make it work for you. And that's why I think it's really important now that we go back to personalization.
Do you know that I've done a DNA test and I found out a lot of things about me that I didn't know? Okay. For example, vitamin D lack, it's something that I have in my gene, so I will always have it. Or like iron deficiency, I keep taking tablets, but they don't work. So
that's why you came and live in Dubai? You needed more vitamin D? Or?
One of the reasons, yeah. Then, for example, iron deficiency, like I need to do drips. If not, like any tablet would not work, because I don't have some things. I'm not really good. But the idea is like that you're right. Everything has to be personalized. And we are lucky, I believe, to live now in this new generation. We are millennial, right? We were not that educated, but I'm glad to witness that the world is shifting. Well-being is the new focus, and we're all investing tons of money and tons of effort and in trying to educate ourselves when it comes to that. So I feel like what you're building here, it has a really, really huge impact and value. What are the top 3 things that people come to you, to Aneeq, for?
I think the top 1 category is hair loss for the moment, and this is what we are known for, because this is, let's say, this is facing a lot. I mean, a lot of guys are facing this kind of issues. More than 50% of the guys in the region before the age of 35 will start losing some hair, and I'm sure we're talking about taboo. Losing hair is not as taboo as it used to be. You see now people, they do hair transplant, they are totally fine with it. They will basically maybe look for different solutions, talk about it more than before, right? So this category is our key category. The second one is intimate health. So when we're talking about intimate health, we're talking about premature ejaculation, we're talking about erectile dysfunctions. So when you are using these kind of words, People are getting crazy. So that's why we use PE and ED. That makes people a bit more comfortable,
Okay.
even to talk about it. But that's where you see there is still a lot to be done in terms of education and approach to these kind of categories. And now we're working on a new category, which will be weight loss, and which is upcoming, and we truly believe it will be coming directly in the top 3 and even more than top 3 again.
I mean, that would be amazing. And when it comes to like educate your guest, your customer, what do you usually feel is the best? What type of tactics or like practice do you guys do?
So for us, it has been a big business decision in terms of how we can communicate our messages, because we want it to be trendy, like to be a cool platform where you are happy and you feel like part of the community. But we wanted as well to make it backed by science, really medication, based. And then you have this kind of balance when we're talking about medications or medical. You are seeing the doctors, you are seeing the white collar, the blue collar, nothing pretty standard, pretty premium or anything. And then that's not what we wanted. So we were looking for this sweet spot. And I think we're using a bit of both. So the doctors, of course, as the knowledge figure, because he has basically the expertise of what is working, what is not, what he has been trying on over the past clinical trial and stuff like this. So the doctor giving the information about how the treatment works is really important. Okay. But as well, we needed to have this kind of very trendy approach on everything else which is happening today. UGC, I'm sure you can tell how they are impacting, or all the different, let's say, patient, customer-generated content that are very important for us. So we're not using this kind of tools at the same level within the funnel. Let's say at the beginning of the funnel, you will believe much more random at the time, I think. So UGC, we use it very for awareness. When the doctor knowledge, we use it more for consideration. And then we're going to really push for the product USP for conversion.
And retention, what do you guys use?
So basically, it's the results. And here we have like a team of pharmacists that are basically in touch with our patients on a daily, monthly, weekly basis, okay, whenever you need it, to make sure that you are consistent with your treatment, that the results are showing, and that there is no side effect, or that you can overcome them very easily.
To be a founder in the healthcare industry, do you think you need to have something different than any other founder?
Not being part of the healthcare.
No. Okay.
What I mean is that when I started, so my background is purely business. I'm not a medical or healthcare person, and I didn't know anything about this environment. So within the first 6 months, I told you we were in touch with DHA in order to make the regulations. But I got in touch with a lot of different stakeholders within the industry. And most of them were telling me, maybe you have a chance to make it because you're not part of this work. And because all of them, they were like, this will take way too long with the regulations in order to make a hit.
Because you didn't know what you were going through.
Exactly. So. For me, I thought that in 2 months I will launch. I launched 14 months down the line. So, you need like to be a bit foolish in order to go into this journey, especially to tell the investors and to have everyone keeping motivated, even if it takes long before launching.
If you knew they would have taken you that long, do you think you would have done it?
I would have made it differently. I think we really stick with the regulations and we didn't want to start anything before. Now that I've been managing the startup for more than 2 years, I think that we should have been much more proactive at the beginning with MVP that is much more powerful. I'm not saying selling the medications because we will not have been authorized, but at least gather some feedback from the users, make some waiting list, or get this kind of traction even without anything to sell. I think this is key, and this will have helped us at the beginning.
Okay, at least you would have done it. Let's say yes.
But that's what I recommend to everyone launching something. You always think, okay, I missed this, I need this to start, I need this. No, honestly, a waiting list is more than enough. I know that a lot of people are saying it, but this is true, As soon as you show an investor or someone which is willing to invest, hey, there is 1,000 people waiting for this product, khalas, I think you're good to go.
Yeah, 100%. The problem is to get these 1,000 people.
Yeah, but I mean, from a marketing perspective, you're an
Yeah.
expert. I'm sure there is different tools today that you can use
100%,
in
yeah.
order to make it happen.
100%. What would you say is your biggest challenge, technology or culture? What was your biggest challenge?
Both of them.
Hard to say.
There is challenges everywhere. I think more the technology at that point, because so that will be a bit of a geek conversation, but we don't have only the e-commerce module. There is the e-commerce module rolling up with the telehealth module. So there is a lot of, let's say, APIs that are called in between the two modules, which makes it a bit tricky as soon as we make any change. So on the technology side, it's a bit tricky because the telehealth part needs to be validated and certified by all of the regulators we mentioned before, whereas the e-commerce module is a very standard e-commerce module. So there is a bit of challenges there. On the cultural, I think it's making a lot of, let's say, changes very fast. Since we started, we can see already that there is a lot of evolution.
Shifting mindset, yeah.
Yeah.
And which one is the biggest misconception that you keep hearing in the region when it comes to, of course, healthcare?
Yeah, I would say this: guys don't take care. I mean, guys don't want to take care of themselves, or guys are not willing to take care. I think no, you just need to give them the tools. You see, and that's why we created this platform. Even on the skincare, which is very basic when it comes to take care of themselves, but I think guys are more willing to, let's say, use skincare than before, or even they are more interested into it because we're gonna live a bit longer. You see the first sign of aging and you want to take action. So yeah.
Yes, I convinced my husband to start using a bit of skincare here and
What
there.
does he say then?
He's happy, but he feels that people will judge him. At the beginning, he felt like the more he would take care of himself, the more the other friends of his group will judge him.
Okay.
Whilst now a lot more people in the group are taking care of themselves, so it feels normal,
But even it depends taking care of himself. I mean, it could be by, as we mentioned, going to the gym, and guys are going a lot to the gym.
Yes.
It could be about cosmetics. It could be about the doctors. It could be about the trackers that you mentioned, doing some DNA test or even some blood tests just to control your different health trackers. So yeah, there is a lot of different way of taking care of yourself.
100%. Yeah. Also, not only when it comes to aesthetic, because I always recommend everyone. I have so many friends that have a lot of wrinkles now. Maybe people are gonna judge me about it, but I'm pro Botox.
Yeah.
And I feel like I always recommend it to them, and they're like, "That's stupid," like that only girls do that and stuff like that. But then they end up being like 40, they look like 60, So I'm like, you should have listened to me earlier. But not only when it comes to that. Let's say, for example, a lot of men are thinking about. We're in an age where a lot of our friends are having baby now, So I'm always like, I see the two different approach. So like my friends, the girlfriends, they always, whenever they are ready, they start to take care of themselves a little bit more, to implement different supplements, going to the gym, or do anything that it has to be done to prepare themselves for that moment of life. Whilst men, they don't. There are millions of studies that talk about how, literally the sperm will affect pregnancy. And not only the baby, but also your partner body whilst she's pregnant and so. So million of study out there, still it's a taboo. Men don't think they should do anything when it comes to that topic.
I think it's a very good question. More on the personal point, this is not something we're working actually actively on the business, but I think when it's about pregnancy, delivery, and babies in general, we are lacking a lot of education. It could be how to prepare your body, you're right, how to deal with pregnancy, and even when you start the parenthood, right? And we're not prepared to this. At least, I'm missing a lot, and you have to get all of this knowledge by yourself, right? So that's a very interesting category. I know that fertility here in the country is a big matter as well. You have a lot of different fertility centers and even people doing fertility tests. And I think this is great. We should be more aware of this kind of stuff and not be ashamed. Doing a fertility test doesn't mean that you can't have babies. It means that you're just checking in. freezing eggs or stuff like this, the same, it's just being preventive. Again, we're not saying that this is the how can I say, the last resources or the last thing that you need to do. It's just that, hey,
Just
be preventive,
Yes, and the same is when it comes to aesthetic, like aesthetic in general, people feel like that if you start to prevent, if you start to do Botox or like facial and so, you're ugly, or I don't know, like why do it? You don't need it. I mean, like it's all about prevention.
So that's a very good point, because as we started this, one of the co-founder is a dermatologist, Dr. Hassan Gladari, one of our co-founder, right? And he's as well basically having his own clinic before he was with us, okay? And we started speaking about aesthetics, and he's a truly believer as well in fillers. And that's why, when I started having this conversation, even my conceptions of aesthetic before was maybe like your friends, judgmental about fillers, Botox, and everything. But I think we need more information. I'm not saying it's good, it's bad. I'm saying it may be a solution for you.
Yeah, 100%. Okay, so let's move into the next topic. I know that you guys have a huge monthly retainer with your customer, and it's around 80%.
Yes.
And that's quite high.
It is.
What keeps people coming back to you?
So most of our treatments, are subscription treatments. Because for the hair loss, for example, you need to be taking the treatment for 3 to 6 months to see the optimal effects. So people basically are ordering on a monthly basis, in order to see the treatment, the results. Even after these 6 months, let's say, they keep being with us for a longer period of time, because they will reduce the frequency of the treatment or reduce the dosage in order to keep the effectiveness of the treatment, right? So this is the difference between a standard e-commerce model and our subscription model. And even for the weight loss, this is what we're going to tend to. It's the subscription-based model, right? And it's very important to have this in mind when you are starting the treatment, that you won't see the effect within the first few weeks, right? You need to be patient and consistent with the treatment, and that's what makes the difference. So 80% is a significant amount, and we're very happy about it. When you look at regular marketplace, that will be around 20-30% in the region.
I don't know if you heard, but everything is shifting into subscription model, like we have, like nowadays with Spotify, Netflix, even car washes, beauty salon and things like that. So I think you guys really nailed down your subscription model. Is there anything that you want us to know about the weight loss program that you guys are launching?
I will bounce back before answering the weight loss. I think on the subscription is very important to people, are not very convinced about this. I'm sure even yourself as a customer, sometimes you feel frustrated. Why do I have to subscribe for this? I just want to try it one time, So it's really important that even if you have you try to focus on the subscription model, that you give them the opportunity to have this one time to try the product, for them to understand, especially for us where it's medication, for them to see how their metabolism and body is reacting to the medication, stuff like this. Because if you are too strict about your model, then you may not attract the good users as well. So you still need this flexibility.
Yes, I agree, but I also disagree, because there are certain things that I get frustrated because I might not use them enough, and I feel like after 6 months I wake up and I'm like, oh wow, I have 5 subscriptions, and I start to remove them and so. But there are certain things that I wish I had a subscription for, so that it will remind me, or like it will keep me on track, or will keep me reliable, So gym, I'm happy that I have the subscription. If I hadn't, like if I wouldn't have invested all of this money, or like personal trainer and so and so, I wouldn't go. Let's be honest, right? A lot of time people need that extra, I think,
motivation,
investment, or like a reminder, to go to the gym, or to in this case, like to take care of themselves and so.
Of course, because here it's about taking a pill, or so we have like capsules, or we have as well topical solutions. So you need to think about it. So the subscription model is the easiest way. So at least that you need to be consistent each and every day. But I'm just saying that you are closing some doors to your business if you're not proposing as well some alternatives. So yeah. So I'm sure maybe you're aware, but GLP-1 is what everyone is hearing about today. So you get the big brands such as Wegovy, Ozempic, Mounjaro, and stuff like this, right?
Unfortunately.
So these
We
are
hear about it.
peptides, right?
Yeah.
So peptides, and so the former ones, it was semaglutide, and so the latest one, which is Mounjaro, is tirzepatide. Okay,
Okay.
I will stop with the
Good.
difficult words. Okay, just for you to understand that these peptides basically will, of course, burn fat. Okay, and that's why you will lose some
And they keep your
weight.
glucose level down.
But they also basically will burn some muscle. So you're gonna also lose some muscle. So these treatments are very effective. Okay, you have seen the clinical trial. Maybe you have some friends that are taking it. They are effective. It's not about the questions. But I think you need something else on top of it. That could be a medical follow-up, a medical advisor on top of it, nutrition-wise and workout-wise as well. Because if you keep losing some muscle, it won't be good for your metabolism. So, for example, it is truly recommended when you are into GLP-1 to work out, even more than you used to work out before. So at least you're going to keep or grow your muscle mass, which is the most important for your body to be in a good condition. So, of course, we're going to provide this kind of peptides, okay, compounded with the right dosage for everyone, okay. But we are trying as well to make the extra mile with basically some add-on in terms of ongoing care, in terms of follow-up programs for people basically to have the holistic approach of their weight loss.
So there is a lot of like different opinion about Ozempic and so many other
Yeah.
like medicine that people are using nowadays, when it comes to weight loss. How comes everyone has that bad opinion about Ozempic, and we've seen so many bad results, like so many good results, but also so many bad results. Like, is there anything that people should know, should avoid? Like, my father-in-law used to take Ozempic because he was diabetic. So, like, is there a regulation there that should be made, or?
So I think that the research goes so fast nowadays. You see, we have launched this treatment a few years ago. Now we're already at the stage 2 with tirzepatide, which is tackling, let's say, twice the hormone that it was tackling before. Now we are going even further. It's going to be a phase 3. So I think that what's going to come tomorrow will always be better than what is existing today, what was existing yesterday. Okay, so this is the first thing to understand. Then, as I mentioned before, I think that you can't have a general rule of thumb that says this is good, this is bad. I think it truly depends on each of your cases, of your medical conditions, that you need medical advice from a licensed professional in order to have the right approach for you. Don't take GLP-1, and this is a prescription medication, if there is some contraindications within your medical history or your medical condition. You see, for diabetics, it depends on what type of diabetes you have, okay? And the dosage that you will have access to depends as well on your diabetes. So yeah, there is a lot of different conditions, and that way it can fail if you are not wisely advised, or that's why it can be a success if you are well advised. For us, our goal and our approach will be microdosing, because a lot what you're listening of the users is that if you inject yourself, okay, one injection per week, at the end of the week, before the next injection, you will be craving. And then you may eat some snack, you may have some cravings that you usually don't have during the week.
Okay.
So instead of injecting the full dose once a week, we want to inject maybe half the dose twice a week, or do some microdosing this way. In order
Some adjustment.
Exactly. And for your body basically not to have like this huge impact at once, but more to be a flawless consumption.
Okay, yeah, well, it makes sense. Everyone is talking about AI.
Mm-hmm.
I'm sure that you guys want to jump on it, or you are already on it. Tell me more about how do you face that?
Yeah, of course. I think we spoke about longevity. Longevity is trendy. We are more or less into this trend. AI, of course, is the other big topic nowadays. AI for us is a bit tricky because as a telehealth platform, we have to still have doctors behind it. Okay, and as a patient, I'm sure you feel comfortable that it's not only reviewed by AI, that there is a
100%.
doctor.
Yeah.
Right? So there is some limitation on how we can use it. I think for customer support on the first layer or something, it makes sense. For the machine learning on basically the patents, so I've mentioned to you that there is an online assessment. There is a logic behind it that has been implemented by the doctor. So if you answer this, that the treatment that you're gonna have, okay? But tomorrow, I think by collecting the data of basically the quiz itself, the assessment, and the results, the machine will learn much faster than the doctor will be doing during his studies. So I think it's very important that we're using this in order to understand and make it optimize our treatment even better. So I think that's a way we can use AI that will make the difference.
Is it, how relevant is the fact that 50 years ago there were so many things that, so many symptoms, so many diagnoses and so that we did not have. Nowadays everything is changing, people are living longer and eating differently and so and so. So how important are those data? Because all of the study they've done in the past, whilst nowadays I feel like we don't have many information about what is going to come in the future.
So again, I'm not a doctor, so don't take this as granted. I would love our co-founder, Dr. Hassan, to answer these questions. But for me, it's as well about the accessibility to information. A doctor is a human being. You go and you see one or two, they will have a different diagnosis. Today, with the access to AI, even for me, if a doctor uses AI on the side as, let's say, a support, it's fine because he may forget about, okay, this kind of logic in between these two symptoms that will make sense for this disease or this pattern, and then it's truly helpful, and I think that the access to a more comprehensive information will make this diagnosis better, and that's why maybe we are discovering even more patterns that you were mentioning.
What do you think about people that auto-diagnose themselves with the AI? Because it's something that everyone is doing, right?
Yeah, I've been reading about it. I think the CEO of ChatGPT has been in OpenAI. I've been mentioning it recently on LinkedIn. I think
Yes.
I've been reading it about ChatGPT Health. I think you can't say no. I think as anything with AI, you need to be open about it. It depends how you are using it, right? I would say self-diagnosis is fine on the first step. You have been doing it, I'm sure. I've been doing it myself. So I won't say that don't do it. I think and the AI is getting better and better at it. But I think that before taking any medication, you still need to go through the regular process of getting a doctor and a real prescription. And that's why we are trying to make it easier for you to access this kind of stuff. But I think as a first step, it's fine.
Yeah. And to be honest, mostly I use it also as a support. Let's say, for example, it was actually a real case. I think it was 2 months ago that there was this flu around Dubai. I was really sick. It was 4 or 5 days, the temperature wouldn't go down. So I kept asking ChatGPT, and it told me until day 3rd, it's okay. Day 4th, you go to the hospital. So I did what ChatGPT said. And when I arrived there, they gave me this prescription. And so I don't know what they wrote there. I was really sick. I didn't even hear the nurse, So then I went back home. I took a picture of the prescription of the medicine and I'm like, how should I use it? So it just helped me on how to, what is the dosage and when should I take it, before, after food and so. So I feel it's a really good complementary tool, to use.
100%. And even when you get your results from the DNA test or the blood test, I'm sure you can get even more information about your health in general. What I think is, for example, when you go and visit the doctor, sometimes you go for nothing, just because you're a bit scared or you're a bit, there is this kind of people that are going for the doctor for nothing. And this could truly help. So it's like, hey, relax. What you have is viral. It's fine. You won't die. You're going to make it out. And that will truly help for the countries where the medical, let's say, segment and industry is very overwhelmed. So at least there is less patients going to the doctor. So this can help. But at the end, it needs to be a step. It cannot be the end of the journey. AI.
Yeah, it really depends on your symptom and so, but yeah, you're right. I remember like living in the UK in London, even to get a simple appointment, it will take you like a week. So ChatGPT at that time would have helped, but we didn't have it. So funny enough. What's next for Aneeq?
First, growing the team. We've been a very small team and we're still very early stage startup. So I think growing the team and making sure that we have the right people in order to make this grow. Keep growing in UAE. I think, before going to anywhere else, I think you need to make sure that you understand fully the UAE market. Then, of course, there is some international expansion which is planned. Saudi is one. Egypt is a second market that we're looking at as well. But first, I think we need to focus on our domestic market and to make sure that we are let's say, first men's health platform in the UAE, then to be the one in the Middle East.
You are co-founder and CEO. So I'm sure you are, of course, behind the expansion, all of these 2.5 years of hard work. And so how can you describe being a CEO for you? What does it mean? What does it look like?
I think there is a lot of points that I didn't even know before getting this title, what it meant. Because back to what I was doing before, I've never been leading a company by myself, and I didn't know what was the role of CEO. I think that the role of CEO is a lot of different stuff, but it's 5 main points. We've been mentioning about it, but I think the day-to-day, of course, making sure that the company is growing and that the operation is going smooth and that the customer are happy. I mean, the day-to-day. The second point, I think, is the vision, the strategy, always thinking about where are we going, trying to drive basically the path for the team to follow. I think it's key. The third one, I would say, is the financial situation, making sure that it's financially healthy, that you have a real forecast, that you are hitting the numbers, that your investors are happy. The fourth one, I think, is decision making. Don't be scared of, let's say, making hard decisions, because that could be a make or break for your business. Just delaying, postponing some decision that you think, okay, I don't want to hurt this vendor, I don't want to hurt this colleague, I don't want to whatsoever. I think making hard decision is part of the process. And the last one, I think, is people management. We started without any employees, but still, when you don't have employees, you're relying on third parties. I mean, you're an agency, you know this, with all of your clients. And the way you will manage your client is maybe the way you will manage your colleagues. So one point is really how you behave and how you interact with everyone in the ecosystem. And so I think it's like these 5 points. I was very good at some, not as good to others. And that's why now, for the growth of Aneeq, we're making the decision to hire a CEO which is much more experienced. And I will step back and I will be a CEO. Because I think that, for the expansion, it's really important that you take someone that has done it before and that has all of these 5 very accurate. And I truly believe into this company, and that's why we want to make it. So, sometimes as a co-founder, you need to make hard decisions, as I was mentioning, and this is one of them. But I think you don't need to be, you need to be fearless about making them.
And it's admirable what you just said, the fact that you want to step back and give the role to someone else that has more experience. And so, because many CEO have a huge ego, thing that you don't have, because I know you personally as well.
I do, honestly, always your ego will be affected, but at the end of the day, you need to reflect what you want, what's the best for the company. I think at one point when you are gathering with some people in a project like this, you always need to have the same objective, what's good for the company. And maybe if your ego will distract for a few minutes, you put back your cap of the co-founder and you're like, okay, this may be the right path for the company.
That's the best. Yeah, 100%. At the end, you have a vision. You know where you want to go, and this is going to bring you there, most likely. Let's say I'm a man. And I want to start my healthcare journey. Let's say I want to improve myself. It's 2026, it's January, and I want to
New
start
year,
from
new me.
somehow, I don't know, from something, you know, like what should I do first? What would you recommend me to do?
Look at you in the mirror. First of all, I think that
Okay,
this
do
is
that.
something that most of the people, don't really do or don't really look at carefully.
Can't believe I do that so often.
No, but
I'm joking.
for example, losing hair, if we go topic by topic, losing hair is not an issue. We are losing, let's say, 50 to 100 follicles a day. This is not an issue. If you find some hair on your pillow or in the shower, this is not this. It's more about the receding hairline that you're going to notice, the thinning at the crown and stuff like this. There are signs that you need to take action. So first of all, if you have this sign, please come to us and we can advise you on what's the next step. On the intimate health, I think it's having a conversation with your partner. Is there an issue?
Ask her, yeah.
Yeah, I mean, definitely it's. I think communication is key in a relationship, and this should be part of the topics. And then, if there is something, please again come to us. We'll be more than happy to consult and to help you on this. But yeah, look at yourself in the mirror on the physical way and as well on the mental way of like really look at what's good with you and what's wrong with you.
Okay. And apart from like looking at myself, and sometimes people have a different way to criteria to judge or measure themselves, right? Is there any maybe test or like blood test, DNA test, or anything that people should do to be aware of what's coming for them?
As I mentioned, I think that everything which is happening on the ecosystem is great today. The way we track our health with the different tools, bracelets, or whatsoever is great. I think that the different blood tests that are telling you that you like this, you're more on this, it's perfect because it's personalized and it gives you exactly what you need to take. Because sometimes you see a lot of people taking supplements, but they don't have, basically for you the iron level is low, but for some people it's super high, but they keep taking iron, so it won't be effective either. For on our side there is biotin. Maybe you've heard of it. It's on shampoos, it's on different stuff. Biotin, again, it could work for you if you are deficient. If you're not deficient, it won't work. So you still have enough. I mean, it won't have any tremendous effect. So all of these tests to make sure that it's right for you will make the difference.
Yeah, no, I 100% agree. It's like what I was saying with electrolyte. If you're not an athlete, why do you take electrolyte every day? Like it doesn't make any sense. And I also think there are different type of category. Like, like not every woman is the same, and not every week for a woman is the same. Same thing with men, I guess. Like you guys are not all made in the same way. Like even though we feel like men are all the same, that's what people keep saying, but it's not true at all.
Yeah, but for electrolyte, for example, from one person to the other, you will lose more salt, more water during the same exercise than someone else. And then you don't need the same electrolyte level. So, yeah.
Correct, yeah. What is the biggest actually misconception that women have when it comes to men health?
You tell me.
No, I want to hear from you. Because I might be biased, like.
So the woman misconception of men's health?
Yeah.
I think the first one, that will be the same for both, for men and women, is that guys don't take care of themselves. And for some, I think there is still this taboo or stereotype that it's fine for guys not to take care of themselves. Some ladies saying, okay, if my guy is taking care of himself, he's not virile anymore, or he's not like a strong man anymore. I'm like, no. This is not how it happens, and I'm sure down the line the partner will be even more happy than the guy himself that he made the step to start taking care of himself.
I agree. That's what I wanted to end up talking about, because like I feel it comes from how you were raised. How do your mother, if she teaches you to put sunscreen, yes or not? If she teaches you to hydrate your skin, yes or not? From the basic, right? To brush your teeth, and so it comes from that, and then also it goes up to your partner, I would say, in the future, like to accept or like to educate you, or like even to like promote the fact that is more than normal and more than like important to be able to take care of yourself. Because you're right, have so many friends of mine that when they hear that, for example, I recommend my husband to do any type of treatment, facial, Botox, and so they're like, "Oh, you're transforming him into a girl." I'm like,
How
no.
come?
I mean, not really. I mean, I just want his best, like. So I think the biggest misconception the women have is that if a man takes care of themselves, he's not that a man anymore. Like,
But there is plenty of factors. You mentioned the education from the family,
yes,
but I think as well the current environment, let's say today we're in Dubai, in the UAE, will be different than our hometowns. In Italy, in Albania, in France, and I still see it with my friends at the moment. We don't have the same vision about what it could be. Your friends in general will have a huge impact depending on the circle, depending on their background, depending on a lot of things. So there is plenty of factors that play a very important role there that you need to take into consideration. But I think down the line, you need to be able to say, if it's your partner, you always want what's the best for him, what's the best for her as well, on the opposite case. And that's what matters. If you truly believe the other, it's that he wants your good. So, yeah.
100%. And you guys are doing that pretty amazingly. You are educating people, you're building a community, so I'm sure that will expand more and more and more.
There is still some room for improvement, but thank you, and I'm sure we can do even better.
Yeah, 100%. But this is just the start of a huge company. When it comes to tech, is there anything that you guys are aspiring to build or like to develop?
So as I mentioned, for us, it's a bit, there is different modules working together on the tech. One of the biggest mistake we've made is that we didn't have a tech guy from scratch within the team. And I think we've been outsourcing to different agencies, and this has been the big mistake. So I think owning the product is very important. The next step will be to own 100% of the product, so the full journey. So I was mentioning the telehealth and the website. And then there will be the app. Because you were mentioning it on the subscription, etc. At the moment, the ongoing care, we're doing it via different, let's say, communication channel, via the website, WhatsApp, emails. But there is not something better than a push notification, for example, to remind you about your treatment or something like this. So I think the app will truly help as well on retention and on user experience.
And any plan for loyalty program?
Of course, we're working on the referral program. We already have with different doctors that already basically referring us for their patients to get their medication. So yeah, this is ongoing.
I think whenever you guys are going to build the app and the entire journey, that would be the moment that you can leverage the loyalty program and
of course
install a better clientele base. Well, we talked about AI, we talked about the app. I see Aneeq doing pretty well in the region. Is there anything that you guys are struggling with right now?
It is. There is always plenty. I mean, you're a founder yourself. I'm sure that
daily.
that's our day to day, right? We fix. So there is plenty of new challenges that we are facing on the acquisition side, on the retention side, on the tech side. So what is important, I think, is to have, again, the right team in order to make the right decision. Especially at this early stage, if you don't have the right expertise, you can make a lot of wrong decision and lose a lot of time. And that's where you need to be careful, is that get the right expertise to make the right decision.
And I don't know if I ever told you, but I've listened to a podcast they were talking about like what is really the role of a founder or a CEO. And it's basically an HR manager, because you keep just hiring and creating your role, and then you fill this role, and then you hire the right person, and then a person on top of this person, and you understand at the end what role was meant to be, and then maybe this person doesn't work for you anymore, and so and so. So like I find this being the biggest challenge for me, to be honest, when it comes to my business. Do you face the same?
Of course, I mentioned people management, I think, as one of the 5 tasks of the CEO. And for me, the toughest challenge is that, you always have this kind of titles, that you're thinking within a startup that you need, okay, the tech guy, the product guy, the designer, the customer support, the sales and stuff. And for me, I'm like, this is not what I need. And I think it's about making sure that you understand what you need, you know, and I don't think that there is a clear path. It really depends on each and every startup and each and every company on what is the profile that you need. I will take you a tangible example. A few weeks ago, we're struggling with the data because we're not using any SaaS at the moment or any ERP. We jump from Excel at the beginning to Airtable at the moment, which is a better Excel sheet, to be honest.
Yes.
But before basically scaling, we want to make sure that we have it right before understanding exactly what we need from what could be Salesforce or what could be HubSpot or what could be Zoho or any
we
of
can
the
do a
one.
discovery soon.
But you see, and I think what I wanted to understand, and I'm not technical enough, is that to have a growth hacker to understand exactly what we need, how we can build the workflow, how we can export the information. And this position didn't really exist. And we want basically to, sometimes it's a data analyst, sometimes it's business analyst, sometimes it's a growth specialist, and you don't know. It's basically draft a job description that exactly describe what you need, and then go to the different profiles and make sure that they have these different skills.
Yeah, because pretty much you need an entire team, to be honest. So you need all of them to do what you're trying to do. And then at the top, you're going to need the architect.
Exactly.
To build the
But there is a starting point.
Yeah,
and,
100%. And what
yeah.
you're trying to do, it's perfect. Because so many people, what they do, they just go to Salesforce or to the biggest one and they just ask them to build it for them. But that is not the way that you're going to learn. So the best practice will be actually for you to build that, the business processes, and then come to us for us to then implement it for you. You
Of
know?
course.
If not, you're going to have something implemented that is generic. And that's not what you should.
And we're still growing. Honestly, we own our processes, but there is still a lot of automating workflow that we can do. And then as soon as we are, how can I say this, mature enough, then that's when you can go to this kind of tools and say, okay, these are my processes, please replicate them in the tool. And we want to make the switch. Exactly.
Yeah, because the software is an enabler, but so many people don't understand that yet. So, so you guys are open to investment, always.
Definitely. We have closed the SAFE agreement basically last year. And now we're going for seed round. Okay. And we are looking for investors because, of course, even if our margin are healthy, that we have clear forecast and a clear plan, we are still burning cash at the moment. We have profitability scheduled for end of 2027, beginning of 2028. And that's why we're going for this seed round in order to, as I said, secure the UAE, grow the team, and then start going to Saudi.
Okay, we're going to add your pitch deck into our podcast.
Sure, man, more than welcome.
So that if anyone is interested in investing in this amazing
please
project,
drop a message on LinkedIn. Always welcome.
And something that always fascinates me is about how do you really live your day to day? Like how the other CEOs live their daily routine, morning routine, night routine, if you have any, especially when it comes to like the CEO of Aneeq, you know, like we talked about taking care of yourself and beauty, health, and so like, tell me about your morning routine, night routine. How does a day look like in your life?
First, I've listened to so many podcasts, I've read so many books where they are telling you about, okay, you should do this, you should have this block of decision making, this block of making, this block of doing.
Do you do that?
I've been trying, but it's impossible for me to keep this. So okay. Honestly, I've been trying to do the big lines, the big picture, but I'm not going very in details. First of all, for me, a good day starts with workout in the morning, a great breakfast. I think this is the best day of the best moment of my day. And then I kickstart the day with a team meeting, so with the key people within the company, just to make sure that everyone is aligned on where we are at with the numbers, on what's next, and if anyone needs to work with each other. And then that's how we kick up the day. And then in the morning, I try to do most of the tasks. And in the afternoon, I try to do all the meetings. That's how I split it. But then I need to be available for the other members as well. So you can't really say, okay, I will do this, because then your team will need you and then you need to give them support. So it's really hard basically to have this kind of blocks that I've been reading about or listening about, because then you're just postponing, whereas your team is the most important. If you own the ship, I mean, we have this kind of comparison that we're doing internally, is that we are fixing the plane while flying it, you know, and basically if you're not answering to the people trying to fix the plane, you're going to crash. So this is the priority.
Okay, so your priority is always the team.
Yeah. What do you think? I mean, I will be curious to hear from you as well.
No, the thing is that I'm a bit OCD, so I have I use Google Calendar as if it's like, I don't know, my personal assistant. So I write everything in there, even like, I don't know, drive to the place, you know, like everything is time blocked, you know, in my calendar. But then during the day, what happened is like a nightmare. Like, let's say someone calls me from my team and they need something, because it happens every day, or a customer even calls me and they need something, I'll jump on it 100% straight away. But then will make me then move the blocks or like rearrange them. And then what happens is usually that I spend like 1 hour a day rearranging my calendar. And that's what bothers me the most. I wish
But aren't you losing time doing this?
Yeah. But I'm OCD, so I cannot not do that. I don't know how to explain, but like,
yeah, of course.
This morning, I was supposed to actually train. I went to sleep so late, so I didn't train. So this morning, as soon as I woke up, I was like, open my calendar, and then I'm like, oh, I need to rearrange. So what am I gonna do this? So I was fixing my calendar.
But for me, that's why it creates frustration, because if I'm not able to do it, I won't be happy with myself. You see what I mean?
Same.
And then it put me on a negative mindset.
Bad mood, yeah. 100%.
So that's why I stopped doing it. And at the moment, I'm still looking for productivity advice, tools, or systems or whatsoever in order to make it more efficient. But I'm still
learning.
processing.
Yeah. The thing is that my mistake is that I underestimate the tasks. So what I'm learning is step by step, because it's a new business for me as well. How long does it really take to do that task? In the past, I would allocate, for example, 1 hour. Now I know there is maybe 2, or maybe some other tasks that I allocate 1 hour, they're 15 minutes. So it's just about knowing the length or the importance or like of the task, and just prioritization. So there are so many tasks that I put in there and I think I'm gonna do them, but they're not even my priority. So I just need to have a little bit more of free time during the day. Whilst what I tend to do is like block it fully, you know, like so.
And I think one thing we didn't speak about as well when you're growing, especially at the beginning, is delegation. Because you're always thinking as a founder that you're the one that needs to do it, because since day one, you've been the one doing it. But as soon as you have a team, you know, you can delegate. And most of the time you forget, and it truly empower people that you are believing in them from day one or from week one, month one, whatsoever. To give them the task that you were doing yourself, you know what I mean? And I think this sometimes I should have done it quicker, and that makes you save a lot of time.
Yeah, but in my case, then what I do, I delegate, and I still believe that it takes that amount of time that I thought, whilst it's not. So I go back to them and I'm like, so where is the project? You know, like, where is this? And they're like, well, it takes 3 times the amount of time
Again,
you thought.
I think this is people management. This is building trust. This is, and I think that this is where we learn the most.
Yes.
Even the patience out of it.
A lot of patience.
Exactly, and this is super
They
interesting.
also need to have a lot of patience with me. I'm hard to deal with, you know. Like, I don't know if you're the same, but...
For me, you know, where I'm learning the most is that I'm expecting everyone to understand from the first explanation. And maybe it's not even the case for me. But, you know, if you're asking me a question that I've explained yesterday, I will say, as I've mentioned yesterday. And I need to remove this from my language, but I can't retain it, you know what I mean? And, you know, this is on... I think learning comes with repetition. You know, if you are working out in any sport, that's by training that you're going to get better. So I'm sure in business is the same. If you keep repeating the thing, and you shouldn't be frustrating about repeating the thing. So you see, we still have a lot to learn.
Yeah, I didn't realize I have this issue too. I just realized I have another flaws. Good to know.
Let's put another block on the calendar then.
Man, I get so frustrated when people don't understand, and I don't even reply. I send, like, for example, if he's on a chat, I will send like the dot with the message, you know, I will take it and put it there.
But imagine, how would you react if someone sent this to you?
I would be there so rude, you know, like, come on, it takes 1 minute to reply, you know. Whatever.
Exactly.
I'm just trying to help, you know. Yeah, you're right. Yeah, I mean, I completely agree with you. I'll work on it. I feel so bad now. But yeah, I mean, it's not always easy, right? And I think we are trying to push, and we're trying to do so much in one day. I was interviewing a guy a few months ago, and he told me, "You see, today we have this podcast. That's what I have in my calendar. This podcast for today." And I'm like, "What do you mean?" He's like, "That's it. That's the only thing I'm focusing on." I mean, I was like, I have like, for example, today in my calendar, I have like 500 things. He would be like, "No, that's the only thing that I want to do." So
And
that,
at which stage is it in his startup or in his journey?
well, he's actually an employer. He's
Okay.
not he doesn't have his own company, but still, he's like, that's the way I like to do things, you know, like, and I will do them properly 100%, and that's it, you know.
But as we're saying offline, basically, when we take some days off, you're feeling bored after just a few days because you're not as active as you should be, and your body is used to like this kind of pace, high pace, and that once you're off, first you get sick. I don't know if it's your case, but for me, I get like sick directly,
True.
and then you're like, "Fuck, I'm bored."
True. Let's talk about it. Why do we get sick? Like, is there any reason?
Because I think your brain sends a signal that okay, there is less. How can I say? Drive or less. How can I put it into words? But there is not as much pressure, so it's relaxed and it's more open to, let's say, all the viruses or I don't know what, or the little stuff that will make you feel weak. And then as soon as you take the plane or something, then you feel sick. I don't know.
Yeah, honestly, I never understood
No
that.
medical advice behind it. I have no clue. I'm just
Yeah.
trying to make it up.
Yeah, no, it's interesting because like I could even fall into like, I don't want to call it depression, but like, let's say if I allow myself to do nothing, oh my god, I will be in bed all day, depressed, thinking about life and the
And
meaning of
rethinking
life.
everything
Yeah.
and quitting and doing it again.
I'm thinking about how to quit and then escape in some island, and then I will be like, oh my god, that would be depressing too. So it's like just a game, you know. Like, so I rather be busy, you know, and
I think we need to learn as well how to step back during this time. Is okay, you're not actively doing the same task that you're doing on the day to day. How I can step back and basically learn from this. And I'm doing it mostly with my family. I don't know if it's the case for you, but when they're asking you questions and you haven't catch up with them, I mean, really on the phone only, but and then it makes you realize how much you have done, what has been the challenges, and this really helps as well. And you're like, okay, and then it puts you back into perspective. I need to do this, that.
okay, I will try. Well, I'll do journaling.
You do? I
Yeah,
don't.
but then I will need to take the time to go and read.
Read it again.
So that's the issue. I do it, but I don't know who's gonna read it. One day, someone is going to read it.
Yeah.
So yeah. Is there anything that you feel like that you want to highlight that we haven't discussed? Is there anything that, for example, what does Aneeq mean to you?
I'm thinking I'm way too emotional. I'm attached to the project a lot because you know when you're there from day one, it feels like your own product, and you want to be proud of it, and you want basically to make it your own. But you know, sometimes I don't know if you think about it this way, but I'm like, okay, 10 years ago, if I was picturing my company, how would you look like? And then it would like totally different than what it is today. And then it's more about, okay, how can I then make it more the way I wanted it to be? I don't know if you see what I mean, because today you're making so many decisions that will result into what is your company, but it may be different from what you are thinking of building at first or from scratch. And then you need to see, okay, how can I make it closer to my expectation and stuff like this.
Okay. So it's like closer to your values.
Yeah.
That's the thing.
Yeah.
Okay.
Because, you know, you're always driven by growth, by scalability, by results. But at one point as well, you need to think about what you wanted to build initially.
You know, I never thought about having a company until 2 years and a half ago. I always knew that I wanted to be like something different, have my own thing, but I never thought about a tech company or like never in my life. So My dream was to have a hotel, and it's still one of my dreams. Like a
Of course.
well-being hotel. That would be amazing on a cliff. I discussed about it already. But
Where will it be?
as Albania is expanding and is growing and is still raw, like there is still like organic product out there, real people, and so I would love it to be in the south of Albania. And be honest.
You have your first customer. Put me on the waiting list.
I just need some investor,
Exactly.
But yeah, honestly, I want to do it. Like have a cycling track, a huge swimming pool to produce our own wine, our own beer, our own food. That would be amazing.
But you say, I think it's all about cycles. Today you are owning a tech company. Tomorrow you want to do something very different. And I think it's all, especially our generation, all about this kind of cycles of, okay, I want to learn this, but tomorrow I want to learn something totally different. And we shouldn't be scared about it, Yeah. It's like, okay, 5-10 years of my life is dedicated to this and then to something else. Even on the way we move, you can see the people flow. Today we're in the UAE. Tomorrow we may be somewhere else, but you should accept this kind of needs. And you were saying that you are changing a lot of opinion or mindset.
100%. Yeah.
This is fine.
Shifting is something that I love to do because I get bored so fast. So for me, like the more I change, not only you will never see me every year the same person. I always change the hobby, everything. So I'm always like that type of person. Even at home, I rearrange stuff out of nowhere. Like you will see my bed moved or like stuff like that because I just like it. So yeah, but I feel like as you said, that is really important just to embrace it, and everyone should. And right now, thanks to, for example, Aneeq, all of the men out there will have the chance to not only embrace taking care of themselves, but also be educated more and more on it. So I mean, Aneeq is your like baby. So I'm so proud of you, and
Same here.
I'm sure you guys are gonna have a huge success.
Thank you.
We will attach definitely your deck or more information, the website, is so to the podcast, so that everyone that is interested can reach out to
Please do.
Pich. And yeah, I would love to have you again in 1 or 2 year time here to
see the evolution,
the achievement, the evolution.
Of course.
So to also have the doctor with us, your co-founder, so that he can give me some tips and tricks. I love to ask this type of question.
I mean, it could be the one on the seat next, or it could be someone else.
Let's do it. So it was a pleasure for me to have you here, an honor, and I only wish you the best.
Thank you, Valbona. I appreciate
you so much.
All the best. Bye.